Hello, everyone, and welcome to our first Ask Kate live streaming event. I'm really excited to be here tonight, partly because I'm Kate, so I'm the one that's going to be answering some questions tonight. I have been working with the Children's Tumor Foundation for, I think, close to 8 years now. I'm a registered nurse. I've worked most of my career in pediatrics, and before I came to CTF, I spent about 7 years working in an NF clinic out in Los Angeles. So I'm very excited to be here tonight. One of the things that I do for CTF is offer what we call patient support. So essentially, I answer a lot of emails and phone calls from families and patients and caregivers who are dealing with living with NF. Someone they love is living with NF, and they have questions about finding care, about what does that mean when there's a new diagnosis. And so I do a lot of answering questions. And so we thought it might be a nice opportunity to use this space in a new way and maybe give a broader audience an opportunity to maybe ask some of those questions. So I am going to introduce some of the folks that are here tonight to help facilitate my conversation, or this conversation, and then we will get started with some of the frequently asked questions that I receive. Danielle, I'm going to have you introduce yourself first.
Great. Thanks so much, Kate. And it's so nice to be here with all of you tonight. I have a 4-year-old who has NF1 and got involved with CTF from the beginning, kind of looking for care facilities for our little one, and have gotten more involved over the years, and am just, excited to share our experience with you and hear from the others that are here tonight.
Thank you, Danielle. I'm going to ask now Maxine if you could introduce yourself.
Yeah, thanks, Kate. Hi, everyone. My name is Maxine, and I'm an NF2 patient. I live in Toronto, Canada, and I've been aware of the CTF for a number of years, but I only really started to get more involved with the organization after attending my first patient forum in 2017 in Atlanta, and I've been faithfully attending that since then, save for COVID.
Yes, yes, that's right. Thank you, Maxine. We'll move on now to Renie, if you could introduce yourself.
Hi, everybody. My name is Renie Moss, and I'm the mother of 2 children with NF1 and a husband with NF1. It started when our son was diagnosed at age 6, when he had a plexiform tumor in his neck that came up, and that was actually the basis of his diagnosis. I've been involved in Children's Tumor Foundation since our first NF forum, which we just established. It was in 2013 in Nashville, which is just 3 hours north of us here in Birmingham, Alabama. Been involved in a variety of ways over the years. Many people know I call it my free therapy. Until there's a cure, this is what I'll do.
Thank you so much. Moving on, I'll ask Gwen if you'll introduce yourself to everyone.
Hey, everybody. I'm Gwen Coverdale. My daughter, Shaylin, is 11. She has NF1 and was diagnosed at 9 months. I've been involved since her diagnosis, first with NF Endurance, and then as the founder and the chair of the Philadelphia NF Walk, and evolved eventually to my current position, which is the vice co-chair of the executive council for the volunteer leadership committee. It's a bit of a mouthful. And it's just been an amazing experience to get to know everybody and to have and build this incredible support network. NF is full of surprises, and it's wonderful to have these great people and families around you to help you navigate the journey. So I'm thankful to be here.
Thank you so much, Gwen. Conrad, could you introduce yourself to everyone?
I muted myself, sorry. My name is Conrad Cordova. I've been involved with CTF off and on for about 18 years, 19 years. I first got on board when my daughter was diagnosed. She's 20 years old. She has NF1, and I have an 11-year-old with NF1 as well. And I've been involved with CTF over the years at several different aspects. And I initially joined to get support and learn more. And I became an advocate for patients in Southern Arizona, helping them guiding them through new diagnoses, getting them resources, et cetera. And it's been a great, it's again, my therapy as well, to get support and cope with some of the things that go along with NF.
Yeah, thank you so much, Conrad. And now, Sasha, will you introduce yourself to everyone? Oh, I think you're still muted. There you go.
Sorry about that. My name is Sasha. I live in New Jersey. I have 3 kids. All are diagnosed with NF1. My children's ages are 10, 8, and 4. I myself was diagnosed after my 3rd baby was diagnosed. And I found and connected with Children's Tumor Foundation in 2019. What does it mean for me to be involved? I feel like I have a purpose. Advocate for my kids, advocate for NF patients, and I also find great support. It's great to have somebody who understands what you're going through.
Yeah. Yes. Thank you. And thank you to everyone who's here tonight as part of my panel. I really appreciate your presence and all of the different perspectives that you're going to bring to the conversation tonight. So let's get started. I thought we would start tonight with sort of the most basic question I get, which is finding care. So finding medical care. Quite often people will reach out to CTF. Maybe they are facing a new diagnosis or they're facing a new complication from a known diagnosis. And they will do some Googling, maybe find Children's Tumor Foundation. If it's the first time they've come across us, they'll reach out and be initially connected with me most often. And so those first conversations, when it's where do I go for care and what can I do to find the best care for myself or my child or my loved one, those are some very important discussions that I have with people pretty much every week. So I'm going to start with talking just a little bit about the NF Clinic Network. This is something that I think a lot of people are familiar with. We have a growing network of clinics that are basically have all worked hard to meet certain criteria that CTF has created because we really wanted to elevate the standard of care for people living with NF around the country. And so we've worked on expanding this network over the last, I think it started in maybe 2006. I'd have to double check my dates there. We currently have 67 clinics. 66 of those are in the United States. And I'm very excited to say that for the very first time, we have a clinic outside of the US in Montreal, actually up in Canada, who has joined the NF Clinic Network. And that's really exciting. That's brand new information just from about a week ago. So really thrilled with that. We want to continue expanding that network. There are still states where there are no clinics connected to our clinic network. So because of that, I want to talk a little bit about what do you do if just, kind of popping into a clinic that's already part of this network simply isn't an option, but because of where you live, because of the type of insurance that you have, those are usually the two main obstacles. And so one of the things I talk a lot with patients about is finding a doctor, even if it's not necessarily, could be a general practitioner, could be a neurologist, could be any number of types of doctor. If this is someone who is interested in understanding NF and learning about NF, CTF has a lot of great resources, not only to educate you as a parent or patient, but also to offer some support and education to your care providers. In 2019 and 20, there were some articles published about the standard of care for children with NF1 and adults with NF1. This kind of research and recommendations is ongoing work that CTF funds and cares very much about, so that people living with the different types of NF and at different life stages can share that and say, here are some of the things we should be watching for. Here are some tests we might want to consider doing. Here's what some of these symptoms I'm having might mean. Because as many of you here may know, often you are your own best advocate and your child's best advocate. And I would say always, that's probably always the case. And so the more that I can do and the CTF can do to empower patients and parents to be those advocates for themselves and for their children, the better. So I'm going to hand it over now a little bit to my panel, because I'd love to hear your experience of trying to access care and what that has looked like for you. So I know, Danielle, if you wanted to share something, I'd love to hear.
There we go. Sure. So this is actually kind of what I call CTF's gateway drug, is their clinic network finder, because that's how I found CTF. And I'm sure, I've heard from so many other families that that's how they came across CTF as well. But I spent a bit of time, I'm in Connecticut, and we have what I would consider or hope to be a world-class hospital down the street, which is Yale. And we don't have a NF expert or clinic there. And so when we were going through our diagnosis process, I have colleagues. I happen to be a genetic counselor and know a little bit about not particularly NF, but the cancer world, and was connected with the genetics unit there. And so that's where we kind of began our diagnostic odyssey of trying to get a firm diagnosis. And we stayed there for a few years, and we kind of got a probably diagnosis, and we searched for some other testing options. And I really reflected on some of the advice that I had given my own patients who were often at risk for breast or ovarian cancers. And my advice to them was always to connect, particularly with a breast surgeon, because at some point in their lifetime, they would probably need one, either for, just in their workups. And so I took that to heart and kind of thought, well, who would I go to if my child had a problem? And it wasn't the clinicians that we were connected with at that time. And so we searched a little bit further, and that led us to an NF clinic that is about 2 hours away. And it's a big deal to do it every year. And he doesn't have any major medical issues. And so it's a full day, and he's little, and he has to, eat and sleep and use the restroom and all of those kind of complications with little kids. But for us, it's worth it, because if there's something that comes up, we feel confident in our care providers that we've found and kind of established that care with. And so I think kind of many of us have searched for kind of a medical home, and CTF helped us find one through that network.
That's great, Danielle. Thank you for sharing. Maxine, did you have something you wanted to add?
Yeah. So as you were saying, like for the people who don't have access to one of the NF clinic network centers, I think, as you say, it is really crucial to advocate for yourself, and to that you also have to be your own expert, because you're going to have to be prepared to tell your story over and over again to doctors who may or may not be aware of all that NF entails. And as an example, I once had an episode of sudden hearing loss, and so I ended up in the ER one evening, and I basically had to persuade the ER doc to prescribe steroids to me, because I don't think they would have known what to do otherwise. And so that's just one example that speaks to the importance of knowing what to do, knowing about the condition, and having to be your own expert, advocate for yourself. Another thing that I've found really important, like when you have to quarterback your own care, is that you have to be organized. And so digitizing all my records, or even just, printing them out and keeping a file, keeping an organized spreadsheet. This has been really important, just because oftentimes I have to bring a big file when I go to see a doctor, because different providers often don't talk to each other. And so you end up having to be that link to provide, to connect the dots and to tell your story to those providers.
Yeah, thank you, Maxine. That's a very realistic picture that a lot of our patients and families are facing, and that's one of the reasons that CTF is so committed to trying to expand this clinical network and trying to increase awareness, right? Not only in the community, but also amongst the medical providers. Thank you for sharing that. Renie, did you want to add a little something to this before we move on?
Yeah, real quick, to follow up on Maxine's point, digitizing records is something that I do a lot. My Google files are very, very rich. I have family health, and then I break it down, Philip, Helen, and Big Philip, because I have a senior and a junior Philip. Most recently is about 3 weeks ago, that Google Doc came in handy, as I was able to send an ophthalmology a scan immediately through the patient portal that had not made it after I'd requested it to be there, because as some of you've ever been involved in multiple patient portals or health networks, maybe your children's hospital isn't on the same network as maybe the research hospital that's associated with things. So it's really important to kind of have that digital tool or a large binder, whatever you're comfortable with, in order to carry those documents. The other thing I was going to say is that, the beauty of having an NF clinic usually is that they are coordinated and they are communicating, and that makes it really nice. So for the majority of our first few years being diagnosed, if we went in to see a specialist, that specialist had already received the records. I didn't have to repeat myself. They were all in that confidentiality clause to be able to discuss our case, which made it a more meaningful appointment. But that's not always the case. As recently as a couple of weeks ago, we were outside of that network in order to see the specialist that we needed. And again, I was going to say exactly what Maxine said, that digital record was able to kind of come together very quickly at a very busy clinic to be able to make that a meaningful and impactful appointment for us. So digitizing records and understanding that if you are able to get to an NF clinic, make that 2-hour trip if you can, like Danielle said. We go every year, even though it's been 10, 11 years, we still learn something new every single year from the NF clinic that we didn't know over the course of that year. So it's been very meaningful and informative to us as well.
Yeah, thank you so much, Renie. So I think I always want to give due attention and service to the power and the benefit of NFCN and the clinic network, recognizing that it simply isn't going to be an option for every patient, and that we want to make sure that we have resources available to you regardless of that. And that is a big piece of what I do. So I appreciate the different perspectives that we're hearing, even just in this small group right here. So I am going to move us on to another question that I've been getting a lot recently, and it's probably not going to come as a surprise to anyone. A lot of what I've been getting asked is related to our current pandemic, COVID-19, and living with NF. And so I'm just going to sort of briefly touch on this. There isn't a lot I can say because essentially, so we know very little because it's a very new thing, right? We all know that science has been evolving the entire last year and a half as we've learned more and understood more. We do know that there's no indication at this point that living with any form of NF puts you at higher risk for severe disease from COVID-19. However, we do know that there are certain aspects of living with any type of NF that might mean that you have a medical complication that's part of your NF that could put you at higher risk, right? Maybe you have cardiovascular issues because of NF1, or maybe you have respiratory issues because of a tumor, right? And so we always encourage people to follow the CDC guidelines, to be working closely with their medical provider to consider your personal risk. It's certainly a very personal experience and personal choice that needs to be made when it comes to, what kind of activities you participate in and how you go about mitigating your personal risks. And then in terms of the vaccine, a question I get a lot is whether it's safe. And that's simply not something that there's going to be a blanket answer to for every person. And so what I have always said is basically, again, to work closely with your medical provider, that there's no reason right now, our NF experts and our clinical care advisory board, we see no reason and there's no indication to consider that any of the COVID-19 vaccines that are currently available are for any reason risky for someone because they live with NF1, NF2, or schwannomatosis. But again, we are not in a position to give medical advice. So working again with your provider to consider whether or not you get vaccinated and when you get vaccinated, et cetera, again, it's going to be a very personal choice. But in terms of living with, through a pandemic, while you are also either living with a chronic condition or living with the complications of any type of NF, or maybe you're the parent of or caregiver for someone who is. If anyone in the group wants to talk a little bit about what that experience has been like, I'm sure that there'd be a lot of universal kind of experience and emotion around what that has been. I'll open it up if anybody has a comment.
I can speak to just the delayed care.
Yeah. So, yeah.
I could keep you here for an hour in terms of that. And I know my experience isn't unique. I'm hearing from a lot of families who are affected by NF, and individuals, adults and children, that their care has been delayed, or preventive care, if it's that annual appointment to meet with the NF clinic, just as, as a checkup, those have been really delayed. And it's been frustrating, but we're, like you say, we're in unprecedented times. In some cases, in our case, we did have a setback. Our son is on a MEK inhibitor. He missed an MRI and he's 16 now. and he's growing about 5 inches a night. And so he was due for a dose increase 6 months earlier, likely. That's kind of what the thought is. The good news is that we are back on track, and in his next MRI, and because that dose increase, his tumor is responding again. So we're back on track, but it was very scary. And I know our experience is not unique. It's just been a very challenging time. So really important for wellness checks for ourselves as caregivers, as well as our children. It's just a very complicated time, and just kind of owning that and accepting that and being patient with ourselves and our care and our medical providers, I think, is important, while continuing to advocate for those appointments that are really, really important to get on top of things. So I'm just acknowledging that it's challenging.
Yeah, thank you, Renie. Absolutely. Yeah, the delays in care can be very frustrating and frightening. Absolutely. Maxine, did you want to add something?
Yeah, so yeah, I guess like one silver lining of COVID is that it's allowed for more virtual appointments on one hand. And so I have been able to have that continuity of care just virtually or through telemedicine with some of my providers. But the downside to that is that it's led to some increased restrictions around out of state, like provision of virtual care. And so over the past year or so, I have been trying to reach out to some of the specialty centers in the NF clinical network, like MGH, Johns Hopkins, and like I've run into some difficulties with even accessing that care because there have been a lot of rules around like disallowing medical providers from offering second opinions like virtually. So that's been quite disappointing, because I thought that this was going to allow me the opportunity to not have to travel, Baltimore to Boston, what have you. And I recently signed up for the National Institutes of Health and to natural history study. However, I have to, for my first visit, I'm going to have to quarantine for 10 days in the US. And that makes it, so on one hand, I feel like, there's been some upsides with COVID, but there's also some downsides.
Yeah, absolutely. Yeah,
For us.
Yeah. No, and we have talked about just the need for that advocacy, that if we can work with, so one of the goals, or sort of the vision of the NF Clinical Network, is also to expand it in the sense that we can build mentoring relationships between clinics. This is sort of the long view. And so if we have clinics that maybe aren't quite ready to be part of the network because maybe their patient population is really small, they're new to the field, they have some things they need to do prior to joining the network, can they be linked up with some of our more expertise physicians? And the goal there being that then maybe you don't need to get permission to see an out-of-state clinician or two, right? Because the clinicians can talk, and then you get that expertise via that kind of avenue, right? So that's one of the kind of big picture things that I know that our clinical care advisory board, which is, I've said that before, so let me just explain. Essentially, it's a group of physicians and clinicians who have agreed to volunteer their time to CTF to meet regularly to help us work through how to improve and increase access to clinical care for people living with NF. So they do a lot of great things. And so this is one of their goals, is to think through how to do that in a meaningful way that helps patients access the expertise they need by removing some of these obstacles. So thank you, Maxine, for sharing that part of your story. It's definitely not unique, unfortunately, and it's something that we hope to continue to address as an organization. Okay, so I'm gonna jump now to another question I get a lot, which kind of ties into finding care, which is when I get contacted by families who are dealing with a brand new diagnosis. So you heard already tonight from Sasha that it's something that is not at all unusual. And even in my years working in an NF clinic, I saw this several times where we would be diagnosing a child with NF1 and at the same time perhaps diagnosing a parent or even a grandparent as well. And it was not something that was known in the family prior to that. So those kinds of diagnoses can happen. We also see adults obviously being diagnosed with NF2, adults who have been living with chronic pain for a long time, and they go through years and years of different doctors to find out finally that they have schwannomatosis. The journey to diagnosis is going to look different for each person. You'll see some connections and some points of similarity, but one of the things that I maybe have a love-hate relationship with about my job is that I really actually love hearing those stories and just being able to offer some empathy to patients as they are sharing the difficulty of, I was here and then I went there and then they sent me to this person and that person. And I feel like I've heard everything and I probably haven't. I'll share just briefly about the idea that one of the things I do is that, so CTF does have some really fantastic resources right off the bat. So if you're someone who likes to read, we have tons of brochures. If you like videos, I've made a bunch of videos that are always on YouTube that you can watch. I'm obviously available for a phone call, or if email is easier. So these are ways that we can sort of get you started. And one thing I've learned is that everyone is going to approach this differently. So you'll have someone who with a new diagnosis who says, I want to know just a little at a time. We're going to take it real slow. I'm just going to deal with things as they come. And that is fine. And we have people who come in and say, I'm going to start a fundraiser tomorrow and I'm going to raise $10 million next week. And I'm going to, right. People deal with this kind of information in a way that is best for them. Right. And so that is another thing that I really enjoy, is getting to participate with people in that journey and offer whatever support that I'm able to offer. So I'd love to hear from some of my folks here, because I actually think the most helpful part of this topic and conversation might just be to hear people's stories. So why don't I start with Conrad, if you want to share a little bit on this topic, and then we'll go from there.
Sorry, I had to unmute myself. Thanks for that. I completely agree with you, Kate. One of the most common trends I've seen in so many people when they've reached out to me here in Southern Arizona with a new diagnosis of NF is that they're realizing that one of the parents had NF their whole life and didn't know they had it until their child was diagnosed. That's my story. I had certain clinical manifestations, cafe au lait spots, neurofibromas, very mild spinal scoliosis. I have a plexiform neurofibroma in my hand, and every physician I'd gone to throughout my lifespan had dismissed every single one. And every time I asked them, what is this? What is this? What is this? It was dismissed. It's nothing. It's nothing. The neurofibromas I have on my scalp and on my back, I had a physician insult me and say, those are lipomas. You need to lose weight, Conrad, and exercise. Those are lipomas, little fat things, and you just need to exercise. Completely dismissed, as well as my cafe au lait spots, who I was told were just benign skin pigmentations. Until my daughter was born and the pediatrician brought her in, or came in and was counting spots and measuring spots and came out, or left the clinic and then came back in with literature on NF, which we were blindsided by that. And that was when my daughter was about 6 weeks old. And that's a very common thing that's happened, that many of the parents I've met through CTF have a very similar story, that they have NF2 or NF also and never knew. And what I've done as far as the way I've been able to fight back or deal with that, because I had NF my whole life and I didn't know and wasn't diagnosed until my daughter was, is as a nurse practitioner, I've had the privilege to present at big nurse practitioner conferences, present neurofibromatosis 3 times, twice to a group of 200 at a local NP conference here in Tucson, and then once to 500 nurse practitioners at a state level conference in Arizona. So it was, my presentation was neurofibromatosis, what it is not, what to do about it. Essentially talked about NF, defined the different types of NF, talked about diagnostic criteria, dispelled the myth that NF is the elephant mask disease, and talked about Joseph Merrick a little bit and who he was, and then who to refer to and what to do about NF when you diagnose someone or when you see someone in your clinic. The wonderful thing is, since these conferences that I've talked at, I've had almost a dozen clinicians reach out to me and call me and say, hey, guess what? I had a 30-year-old female in my clinic today. She has these bumps on her body, these cafe au lait spots. She said, I don't know what this is. She was only there for migraines, and I diagnosed her with NF. I referred her to neurology and recommended an MRI, baseline MRI. So that, to hear that from one of your colleagues was an absolute blessing. And that's been a real prideful thing for me that we've been able to connect and teach so many clinicians about NF.
Yeah, that's fantastic, Conrad. I really, I love that it's not only you have the personal connection, and then in your profession, you're able to have that influence. That's fantastic.
It's been a real privilege.
Yeah, yeah. And thank you for being out there and providing that, because that's exactly what we need, right? I'm gonna actually have Connie share a question. So I overlooked introducing the wonderful Connie Sorman, who is responsible for this wonderful evening. Why don't you go ahead and say hello, Connie?
I'm just that weirdo sitting in the box in the middle on the top that nobody knows who she is, right? So no worries, Kate. Hi, everyone. I'm Connie Sorman. I am a staff member at the Children's Tumor Foundation, and I am also an NF mom. So I have a 23-year-old son named Jesse with NF1, and I got involved with CTF long ago when Jesse was first diagnosed, and I've been around for a long time. So really excited to be here and a part of this conversation tonight. The question that we got in the chat was from Madeline M7, and she wants to know if the new clinic in Montreal will take adults or if it's pediatric only.
Ooh, great question, Madeline. I should know the answer to that. And if you give me a few minutes while we're chatting, I will confirm. But let me it's such new information that I'm still learning, and I haven't connected with the team there, but I can find out. Thank you for asking, and I'll be sure to answer that question before we're done here tonight. Excellent. All right. Does anybody else in the group want to talk at all about, no pressure to share in terms of your journey with getting the diagnosis and, going from there? Oh, Sasha, terrific. Go ahead.
Yeah, so as I mentioned before, I was diagnosed after my third child was diagnosed. I don't know why, maybe because I was born and raised in Ukraine, maybe because it was many years ago. But just like Conrad shared, it just hit so close to home. A lot of my symptoms came in adulthood, actually during my pregnancy. So even when I started developing cutaneous fibromas, I had excruciating pain in my back, and I went to this doctor and that doctor and dermatologist, and nobody could give me the correct diagnosis. And just like Conrad said, my doctor told me, exercise, Sasha, exercise. But I said, I exercise. I practically live in the gym. So in 2013, I was diagnosed with a tumor in my spinal cord. Mm-hmm. And even at that point, it was after my child's diagnosis, after my first child and my second child's diagnosis. And even then, nobody gave me correct diagnosis. I've heard things. I went to a new doctor, and as they're taking my medical history, I mentioned that I have NF1. So medical assistant who helped documenting, she asked the doctor, what is it? Oh, it's just some skin condition. That's how he described it. So yeah, so very important, right? To be in the right place to find the right care. And it goes back to the topic we covered earlier, that it is so worth the travel to.
Yes. Yeah, absolutely. Thank you for sharing that. I like I said, I don't like those stories. I don't want that to be anyone's experience, but I appreciate hearing them so that we know that this is why we're here, right? This is one of the big things that that CTF is committed to doing, is to improve the level of care people are receiving, so that we hear those stories less often, and more often we get people who have been influenced by nurse practitioners like Conrad, who have been using his influence and education to spread awareness so that people are getting to a diagnosis in a much less painful way. So thank you both for sharing tonight. I really appreciate that. I do want to just give a brief plug that I did just a quick search, and yes, the clinic in Montreal will see NF1, NF2, and schwannomatosis, so adults can be seen there. So I know, right? I'm so excited about this, you guys. It's something that we've been hoping for a long time. In fact, one of the clinicians on our clinical care advisory board is a clinician in Canada, not in Montreal. He's in, I think, British Columbia. So it's definitely a connection we've been building. So, okay. We are not in any hurry if anybody else wants to share about this topic, but I'm happy to move us along if there's no one eager to talk. Okay, well, we always circle back around. It doesn't have to be exactly everything in the right order, et cetera. A couple of things I do want to talk about briefly when you are dealing with a new diagnosis, just in terms of sort of thinking through steps or what to think about, right? So if you're thinking of a child, most often that's going to be a diagnosis of NF1, not always the case. But if that is what we're talking about, some things I usually will tell families, especially for kids under a year, is there's no diet changes, no activity changes. You keep loving and raising that baby just the way that you would. And regular visits to the pediatrician, those well visits, the baby checks, those are all still going to happen and good things to do. And then getting care established with an NF specialist is obviously going to be an important step. Often they might consider a referral for an ophthalmology exam. So that's an eye doctor who will take a close look at the eyes. And then watching those developmental milestones in those first few years is going to be a really smart and helpful thing to do. Is something your pediatrician can help you to do. There's also lots of great resources online about sort of when to expect within a large window of what's considered normal for kids to hit certain milestones, like sitting up or crawling, babbling, things of that nature. The reason for that is because often children with NF1, not always, but some of them may have some delays in hitting those milestones. We don't see any correlation between NF1 and any type of intellectual disability, but we may see that they're a little slower to get moving, or they're maybe a little behind in starting to talk. And every state, at least in the United States, provides early intervention services for children under 3. Sometimes it can be hard to figure out where that is, but it is a federally funded program, and I'm happy to help you figure that out. Your pediatrician should also be able to help you. And they'll do a free assessment of your child to say, hey, it looks like they're hitting all their milestones and we're not worried. Or, hey, maybe we could use a little physical therapy and get them crawling a little more, things of that nature. So under a year, those are some things to think about. And then as children are getting older, you can be starting to think about school that's coming up. A lot of times as they're approaching school age, we may consider a neuropsych evaluation. This is not always strictly necessary, but it's something I like to bring up with families. Kids with NF1 may struggle with certain types of learning disabilities, and a neuropsych evaluation is a way to assess not only the areas where they may be struggling, but also recognizing that they may have some areas of real strength that they could be capitalizing on. And so when you're thinking about getting ready for school, just being aware of that increased risk for some learning disabilities, possibly attention deficit issues. So just kind of being aware of those things and knowing what your options are. And again, that's a strength of an NF clinic, but also just a really strong pediatrician who's in your corner and is working with you. That's going to be an important aspect. Now, when you're looking at a new diagnosis as an adult, and you're thinking through what does this mean? Like I found out that I have NF2. What does that mean? And again, there's a little bit less in terms of broad recommendations from me on a broadcast like this, because how you got your diagnosis is going to have a lot to do with what kind of care you may need to most quickly access. Individuals living with NF2 may be diagnosed because of a hearing loss or dizziness or ringing in the ears. There's really actually, I can't even list all of the things that could possibly lead to that diagnosis. And it wouldn't be helpful to try. So essentially, if you're looking at a diagnosis of NF2 or schwannomatosis, it's going to be finding that care team who is ready to address your concerns, right? So in any situation, not only are you your best advocate, but you as parent or you as patient are also the most important part of your medical team. And you should be treated that way. And you may not always be. So being prepared again to advocate for that respect that you deserve as the person who knows the most about you and knows the most about your child. So that's something that I like to talk about a lot and help people understand that, yes, the doctors can seem scary or intimidating, but they don't know more about you than you do. So keeping that in mind. Yes, actually, I would love to have some people chime in here. I'm going to start with Gwen. I would love to hear from you.
Sure. Hi. So when we're talking about the neuropsych eval and the children who have been recently diagnosed, I've been at this for 11 years, but I have plenty to share. One thing that I learned early on with my daughter, we have health insurance. We're very blessed to have health insurance through my husband's employer. My daughter had some delays in her milestones. She didn't start walking until like the last day of her 17th month, and she was delayed in her speech. So we were referred to the local intermediate unit for some support services. While we were there, they recommended we apply for medical assistance. Wait, health insurance, why do we need this? Well, the beauty of that is that it kicks in and it helps you with any additional costs that are not covered by your regular health insurance. Again, I shared that NF is full of surprises. And unfortunately, some of their surprises are medical and insurance related. Not all insurances will cover all the care required by children with NF, and you don't know what you're going to be up against at any point in your child's diagnosis. God willing, they're great and they don't have any major issues, but you just want to be prepared on the off chance that something like that happens. The last thing you want to worry about is financial. So if your state, and most states have these, I believe, a supplemental insurance program, I believe it's Medicaid, apply for it for your child. Don't be embarrassed. It's something that is good to have in your back pocket should you need it. I know plenty of families who have had to call upon it because their child has had to go on chemotherapy and it wasn't covered by the regular insurance, and they had $10,000 in outstanding medical bills that they weren't prepared for. So just be sure to apply for that. And then also speaking to the neuropsych eval piece, I found out about this again, also through my daughter in her early elementary years. I believe that you are allowed to, as an NF patient, it's advised that you have a neuropsych eval every 2 years when you're a child. And even though my daughter is not necessarily presenting with anything new that I'm recognizing this year, it's just always a good idea to have those done, just so you know. There may be something you're missing. There may be something that your teacher hasn't noticed. Get your child evaluated so that you always can ensure they're receiving the support that they need from an educational and learning standpoint, and that they can thrive.
Yeah. Yes. Thank you, Gwen. And we could probably do an entire evening talking about school, right? And IEPs and neuropsych evaluations, and we could absolutely do that. So thank you for sharing that, and about the insurance piece. I really appreciate that. Conrad, I'd love for you to share what you've been kind of putting in our Zoom chat, because you're absolutely right about that's really important. And I feel like it'd be good to hear from you on that piece.
One of the things that I discussed in my talks to fellow clinicians, to nurse practitioners, is in breast cancer screening and in screening people with NF who are adults. Research shows that for sure in NF1, I'm not sure, 100% sure in NF2, in NF1, there's a 5-time increased risk of breast cancer in women with NF1. So the current guidelines and recommendations are to start breast cancer screening at age 30 for a woman diagnosed with NF1. And so that's very important to discuss that with your physician. I discussed that with our primary care doc, and he says, I don't think that's correct. And I said, hey, it is. And I actually printed stuff up and took a primary care physician information on my daughter because she's 20, but it's something that I expressed concern about. And but I did show them some data on the breast cancer, the 5-time increased risk of breast cancer in NF1 females. So it's very, very important that gets relayed to people's primary care physicians. If you're a woman in your 30s or approaching your 30s or older, and you have NF1, you should definitely bring that up with your physician. And there's a lot of data online about it that you can find. And if not, I'll find a study for you and send it to you if you reach out to me.
Yeah, and I'll echo that. If you are hearing this information for the first time and you'd like more detailed information about that, it's definitely something that I can provide. In fact, I think I had mentioned earlier that in the last couple of years, we were able to put out a couple of papers on just sort of updated guidelines for care for adults with NF1 and children with NF1. Those are 2 separate papers. And the one with adults does talk specifically about the breast cancer screening recommendations for women with NF1. And as far as NF2, that is something that I need to do a little bit more research on. I don't know that there's great data on it. And I think, anyway, so it's definitely something to think about and be talking to your doctor about, certainly. So thank you, Conrad, for bringing that up. I appreciate it. Yeah. And if anybody is listening tonight and really wants to see either of those papers that I just mentioned about those care guidelines, I send them to people all the time and say, share this with your primary care provider. I think it's a really good piece of information to have, and really empowers you in terms of helping them think through, what referrals you might need, et cetera. So yes, sure thing. Okay.
Kate, I also put your email address in the chat a couple of times if anyone has private questions or wants to ask
Yeah.
something offline.
No, that's fantastic. Thank you, Connie. I appreciate that.
Okay.
Oh yeah, go ahead.
I was just going to say, because I think the breast cancer risk can be really scary for young women, especially in terms of like, you think double mastectomy or surgical interventions, and it's not necessarily that. I mean, I don't have NF1, but I went to my OBGYN about 2 years ago. After some of these guidelines came out and the research understood there was a higher risk of breast cancer, and my 13-year-old daughter, who was 11 at the time, and I said, hey, my daughter has NF1. She goes, yes, I remember that. How is she doing? I said, well, she has no medical concerns, but I understand that there's a higher risk of breast cancer. She goes, yes, I read about that. So if you want to see me when she's 25, we'll just do a baseline. Is it an MRI breast mammography?
Mm-hmm. Yes.
We're talking about diagnostic, like earlier surveillance necessarily to kind of catch things and be proactive. I just think that's kind of an important thing to say in terms of it kind of moves screening up from what is normally 35 or 40, I think is the baseline. And so you get that surveillance earlier with this diagnosis to, hopefully you're having actionable, proactive efforts as opposed to dealing with something more serious later on. So it's good information to know if you think about it that way.
Yeah. And this data is not saying that women living with NF1 are at increased risk for some like more serious type of breast, like that is not what it's saying. As Renie said, they're saying we are recommending that we start screening early. That's the basic thing is don't wait till you're 40, which is kind of the general population, but start earlier. That is, yeah. So that's an important thing to talk about, but also I hate to ever hit the panic button, right? So reach out to me if any of this conversation is causing panic, because I would love to talk more and talk through that. So speaking of that, actually, I want to talk a little bit about that idea of support. So one of the emails I get a lot or phone calls I get are people asking about support groups. And I understand the appeal, right? The idea that maybe there would be something local to you that you could go to where people would understand what you're going through and what you're dealing with. And it's always hard for me to let people know that those types of in-person support groups, even pre-COVID, were fairly rare. I know of one in California, I think I think there might be a couple others scattered around, but they can be very difficult to launch, very difficult to keep going, kinds of access you need in terms of, what does that look like? And do you work with your doctor? Do you use space at your local clinic? It can be a lot. And so obviously COVID threw a whole new kind of wrench in the idea of building community and finding people who understand what it's like to be living with NF. And so a couple of things that I like to mention is that there are some really great online options if you're comfortable with social media. There are some Facebook groups. There's one called NF Moms Rock, which is a really fun name. And it's a really nice group of not just moms that talk a lot about, what does this look like and advocating for their kids and asking questions. I'm in and out of that room all the time, actually. So, I really enjoy kind of seeing those conversations and what's happening there. And then there are some other options certainly as well in terms of finding support just through social media. I also recommend to people that they consider checking out if there are any CTF events in their area. Are there any a walk or some kind of there's a really great fundraiser that a family does where they sell lemonade. This is not my area. Renie knows a lot more about these fundraisers than I do, and so does Connie. But these are fantastic places to go because you don't have to be there to raise $1 million or to, you don't even have to raise money. You can go to a walk. You don't have to tell anybody you're going. You can just go with your family and you can meet people and you can make connections. And that can be a really great thing. And, pending what happens with COVID, the in-person walks may be coming back soon. And we're hoping that will happen, certainly by next year. But definitely getting involved in those kinds of events can be a great way to find support and connection. And then I'd love to just open it up because I guarantee that the people in this call with me know a lot more about how to get connected and find support than I do.
We actually have in-person walk events this year. So just
I wasn't sure, Connie, because I don't know if anything changed with Delta.
Yeah. I don't want anyone to think they're not happening. Of course, anything can change, but that is the plan at present.
Fantastic. Thank you.
And those are all on our calendar at ctf.org.
Kate, I don't know whether you're going to touch on any of the clinic symposiums, either virtually or in person, but those have been great places for me to connect with families that may share common experiences too.
Yes. Thank you. I actually forgot, Renie. I was meant to mention it, but that was one of the things that I did in my first job in the NF clinic was to organize our symposium. And that's a fantastic place to meet people. And so when those start happening in person as well, and they're great virtually, I think a lot of our symposiums have tried to build in some way of connecting either in the chat or through things like that. And then again, when they start happening in person again, I know that it was definitely a way that our families in the community where I was were meeting each other and getting to know kind of who was around. The worst emails I get are the ones that say, oh, my child has had NF for 11 years and we don't know a single other person with NF, right? I don't like those emails. So we want to help you get connected. And that I will say also is another thing that I do is, and Connie often helps me with this, and some of our other fantastic development staff that are kind of know our families around the country will help me to do, which is if I have a parent or a patient come to me with a story that really reminds me of someone else we already know in the community, I obviously get permission from both parties first expressly, but then I can make those kinds of connections as well via email or a phone call to say, hey, you're dealing with this. And I know a family that's about 8 years down the road, but kind of started in a similar place, right? So that can be another nice option for getting connected.
Or just having someone who understands what you're going through, so they don't even necessarily have to have gone through the same things, but they understand what living with NF is like. So it's a kind of connection that's invaluable in this community.
Yeah, absolutely. Okay. So let's see, we're okay. We have a little more time. So I want to just touch quickly because it is a question I get a lot, and I want to talk about selumetinib. So this might sound, so selumetinib is the generic name for a MEK inhibitor. MEK inhibitors are a group of medications that act in a very specific way. I'm not going to get into all of the details of that, but selumetinib specifically was approved in 2020 under the brand name Koselugo for the treatment of inoperable plexiform neurofibromas in children 2 to 18 years old or with NF1. Okay, so there were clinical trials for years beforehand, before this approval happened, obviously. And it was a big celebration for CTF to have the very first FDA-approved drug for NF. And it is just the very tip of the iceberg. So the response to selumetinib for a lot of children who have been treated with it is fantastic. Renie is here tonight and she can speak to that personally. But we are always careful to say this is not a home run for every single person. It's definitely a very serious medication. The side effects can be difficult for a lot of people to manage. And sometimes they can't manage them and they have to come off of it, and it's not a good treatment option for them. And so while it's very exciting and it's a very real solution, and it's given a lot of hope to the community, which is appropriate. It's a reasonable hope. We also know that there's a long ways to go. So currently there are clinical trials, for a lot of things, but specifically for selumetinib, there are clinical trials looking at the cycling of the selumetinib drug, right? So if children are on it and they've had a reduction in their plexiform neurofibroma, do they have to stay on it forever? Can they come off of it and then go back on? What kind of dosing is the right dosing for that purpose, right? So they're looking at that. They're looking at the response of NF2 tumors, so tumors that occur within NF2 to selumetinib. They're looking at plexiform neurofibromas in adults with NF1, which are inoperable, and the response to selumetinib. So they're looking at the response for cutaneous neurofibromas with selumetinib, right? So they are, and this is not the only drug they're looking at, but I just wanted to sort of briefly touch on the fact that this drug is out there and that there is a lot of research that is ongoing to see how broad its use could be for the community and what we need to be thinking about and looking at for the future. So I just wanted to sort of briefly touch on that. There's also the Intuit trial for NF2, and I'm not even going to try to, Intuit is an acronym, but I'm not even going to try. Essentially, it's a really exciting new type of clinical trial where they get to expand the way they're doing research so that it's less narrow, but it's still safe and meets all requirements for, patients understanding what they're getting into and what they're signing up for, right? And keeping everyone as safe as possible. But it allows the clinicians to look at a much broader scope of the types of tumors that they're dealing with and how all these different types of tumors are responding to the treatment that they're offering. So that's a really exciting trial that's out there for individuals with NF2. And there's also a trial starting up that's ongoing right now that's looking at the response to treatment in the chronic pain for adults living with schwannomatosis. So they're looking at they have a treatment. It's a clinical trial, so there's an intervention happening, and they're looking at the response for those. Often with schwannomatosis, the main issue, and I won't speak for everyone's experience, but often their biggest struggle is chronic, often very debilitating pain. And so this trial is looking specifically at why, trying to treat that because it doesn't seem to respond well to any of our traditional options. So I just wanted to sort of briefly touch on some of that. There is so much we could talk about with clinical trials. We just had our 2021 NF Forum, and we talked a lot about that there. Those videos should be going up on our website soon if they're not yet. So even if you couldn't attend, you should be able to have access to all of that information and some of what's going on there. So yes, thank you, Renie. Good point. There is a website called clinicaltrial.gov, G-O-V. It can be it's a lot to look at, but it's a pretty easy search engine. You can just put in the name of a diagnosis, and if you're looking at a specific drug or you want to know about a specific aspect of that diagnosis, you can put that search information in and it will tell you what clinical trials are running in the United States. And it's a great resource. It's also one that I recommend that you consider looking at kind of in tandem with your clinician or your doctors. And certainly you can always reach out to me if you want help understanding something you see there, or that you've seen a press release for something and you want help understanding it. I'm certainly available for that as well. So I'm happy to do that. Oh, Conrad, thank you. Conrad is so helpful. I can't believe I didn't mention the NF registry, you guys. So that's one of my main jobs with CTF. So the NF registry is a fantastic thing that CTF created many years ago. It is an online patient-entered database. So you create a profile for yourself. You enter your own, you fill out a survey essentially where you tell us kind of how living with NF affects you, what your medical history is. It's fairly brief, but gives us enough information to kind of get a picture. All of your data, it's IRB protocol, so it is extremely restricted. Nobody has access to anything that you put into this database, except those with express permission, which at this point is, I think, myself and Pam Knight at CTF. And then that data is basically the hope of the NF registry, and what we've seen it do already, is that the more information that we have about what it means to live with NF and how it impacts you, the better we can focus our research. We know where to look and what to address, right? You can sign up with the registry. You can opt in to receiving emails where if we know a research study is going on and you've checked all these boxes, like I'm an adult, I have NF2, and I have this type of tumor, you'll get an email that says, hey, a clinical trial is running, or a study of some kind, and you might be interested. That email comes to you, but nobody knows anything about you or has any access to your personal information until you decide to respond to that email, right? So even then it's kept very safe. So if you get an email and you're like, I'm not interested, you just delete it. No one knows, no one's any the wiser at that point. So the NF registry is fantastic. I love talking about it. I almost forgot, but please reach out to me if you have questions or you want to know more about that.
I'd love to jump in about the registry too. So from my understanding of it anyways, it helps CTF kind of provide information to individuals and families, but then also on the back end of it, if there are researchers that are doing research, they're looking at a new drug or they're trying to investigate something, if they know that there's a patient population that's willing to participate, and that, let's say, they need a study sample that's 100 patients and it's going to take them 10 years to recruit that, they might not be that interested in kind of pursuing that study. But if they know that they can recruit those 100 patients in a month, because we have a very active and willing community, then those researchers, those pharmaceutical companies are more willing and interested in looking at our disease. And so this is a really big kind of full circle. So it not only provides information for us, but we want to push the research forward too. I loved hearing the approval of the drug that there's options coming down the pike. And I think as a community, we can show researchers and pharmaceutical companies that we're here, we're in it to end it, and we'll try lots of things.
Yeah,
so,
no, that's right.
Sign up for the registry if you haven't already. And yeah, let's end NF.
Yeah. Thank you, Danielle. That was perfect. And she's absolutely right. Yeah, this is a way that we can, you can feel empowered as a patient that you are doing something active to draw attention to this community and to the needs of this community, so that the people with the money and the people with the drug labs and the people like those are the people that we can get their attention and say, you know, we're here and we're ready to participate, because yeah, we're here to see the end of NF. Absolutely. Thank you. Okay. Well, I think is that time, Connie?
Yeah, we are at the hour. That flew by, didn't it?
It did. That was really fun, you guys. Thank you so much for joining me to do this tonight.
It was a lot of fun. I appreciate everybody being on.
Thank you, Kate. It's nice to meet all of you.
Absolutely. This
Thank
was
you all
great.
so much. Reach out if anybody needs anything. I'm always available.
Me too.
Thank you, everyone.
Thank you.
Thank you.
Good night.
Good night.